Hello, Dr. James Bogash, expert in health and longevity, and I've made it clear that I'm not a big fan of the GLP-1 receptor agonists. I've been following them since the Byetta days and continue to have concerns that are not relieved by ongoing research and from what I see in the practice. And before we talk about some of those, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. That being said, I remember the first time this really kind of hit me, and it was a patient who was diabetic, on insulin, on metformin. I think he was on metformin. He was on the S-glute inhibitors for spilling. He was on multiple medications, and they started him on Ozempic. He'd been on Ozempic for about 2 years. Brand new diabetic drug, expensive, powerful. And so, because of that, you should see big changes in his other medications and his basal insulin. So I asked him, I'm like, well, what happened to the other medications? He was like, well, there was really no change. So I think that should raise some red flags in that it's supposed to be this powerful drug, but we're not really seeing any difference. So this particular study, it was out of Israel, looking at 23,000 diabetics, followed them for 3 years, and looked at the A1C levels using semaglutide. So you would think if this is a powerful anti-diabetic drug that we should see big changes in A1C that are long-lasting. So, by the way, half of the study were women, and the average A1C, remember A1C is what we kind of look at that for monitoring blood glucose. It's a little bit more complicated than that, but a good number is, we want to be around 5 would be perfect, even less than 5. But the average number in this study was 7.6%. So what happened after 6 months on A? It went down 0.77, a little bit, not even a point. They're still diabetic at that point. After 2 years, it was not quite as good at 0.57. After 3 years, it was 0.35. It should be making a massive change in their A1C. It's not. These are relatively small changes and not going to change. A1C is logarithmic, so we want to see these. Even a 1 point change, I usually say, is a big change, but this isn't even a half point change after 3 years. They did say that long-term adherence in general was good, but this just reinforces the fact that I think that the muscle loss with this class of drugs is devastating to underlying health. So even though they lose weight and maybe some other aspects of blood sugar handling are getting better, the big picture is not improving because they're losing muscle mass, and nothing will help you manage blood glucose better than having muscle mass. So also, while I'm in here, I might as well tag on another recent study. It was a poster presentation from one of the universities out of England, a research group, and they found that after, by 1 year, and these were just people using a variety of the GLP-1 receptor agonists, and by 1 year, there was not much difference between the control groups and the drug. By 2 years, this is when people stopped their drug. And by 1 year, there wasn't very much difference. By 2 years, they had regained all of their original weight. 95% of the people had regained it. This absolutely plays a role into muscle mass and metabolic health. These drugs are not fixing anything. They are probably making things worse. Not probably, I'm quite confident they are making things worse. So you're like, oh, well, we can just stay on them forever. There's a cost factor. So maybe if you're paying cash, we can certainly say that's okay. We don't know the long-term effects. I know it's been out for a while, but you constantly stimulate the beta cells of the pancreas. You're going to have, we know that there's underlying pancreatic inflammation. That's got to play a role in some negative consequences down the line that we just don't know yet. As always, I'll post a link to these particular studies in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.